Environmental considerations, heat and cold issues. Conduction, evaporation, radiation, and convection play an integral part in cooling the body and maintaining normothermia and regular body temperature. This is a diagram of conduction, convection, evaporation, and radiation. The direct transfer of heat from a warmer surface to a cooler surface is accomplished by conduction. The degree of conduction is dependent on the temperature gradient, the conductive properties of the object contacting the body, and what percentage of the surface area is in contact. In the setting of heat-related illnesses, this concept becomes important when treating a patient with cold water immersion. As more body surface area is immersed, there is more conductive potential and treatment becomes more effective. Perspiration is an evaporative mechanism that is dependent on sweat production and water vapor pressure gradient. In high ambient temperatures, heat loss is almost solely based on the rate of sweating. As humidity increases, evaporation becomes increasingly ineffective. Thus, perspiration serves as the most effective way for humans to release heat. We can see in this diagram, the more humidity, the more sweat stays on your skin, and we get little to no relief from the heat. In less humidity, sweat evaporates, and we get more relief from that heat. So here in South Texas, we have quite a bit of humidity, which makes using evaporative cooling a little bit more difficult. Radiation is the process by which the body gains or loses heat without direct contact. Radiant energy is reabsorbed or reflected, which is why light-colored clothing can prevent heat-related illnesses by absorbing less heat. Clothing is the most basic and generally the best means of sun protection. Not all clothing is equal, however, and some of it actually isn't very good at protecting us at all. So what makes a piece of clothing sun-safe? Most of our clothing is dyed attractive or functional colors. Many dyes absorb UV rays, which help reduce exposure. Darker colors tend to absorb more UV rays than lighter colors, including whites and pastels. But bright colors such as red can also absorb substantial amounts of UV rays. The more vivid the color, the greater the protection. A bright yellow shirt is more protective than a pale one. But even pale fabrics can offer good protection if the weave, material, and weight are effective at keeping out UV rays. The body exchanges heat with the surrounding air by way of convection. The body gains heat from the hot air, which comes into contact with the skin. Convective heat exchange increases with increasing airspeed or larger gradients between air and skin temperature. Air circulation can be increased by using air conditioning or fans. Clothing that is more permeable to air or loose-fitting can also increase convective heating loss. The next part of our lecture will focus on heat-related factors. When concerned with heat-related emergencies, it's very important to look at the temperature. However, the temperature is just part of the equation to determine if exercise is safe. The heat index is a measure of the air temperature, humidity, and solar radiant energy and is important to determine the relative risk of having a heat illness in different conditions. As many of us in the coastal bend are familiar, increases in humidity can make a day feel much hotter. Relative humidity is the most important factor that determines the effectiveness of evaporative heat loss. Relative humidity is the ratio of water in the air to the total quantity of moisture that can be carried in the air at a particular temperature and is expressed by a percentage. When the air is completely saturated with water, 100% relative humidity, the temperature is higher than skin temperature and no heat dissipation occurs. Athletic events should be held during cooler periods of the day and scheduled to avoid hot, humid months. Athletes, coaches, and parents should be educated about the early signs of heat-related illness, hydration, and initial treatments. Heat acclimatization is the best protection against heat-related illness. This involves a gradual progression of duration and intensity of exercise over 10 to 14 days. Proper hydration, lightweight and light-colored clothing, shaded rest areas, and rule adjustments to allow for frequent substitutions can also help protect young athletes. The wet bulb globe temperature, which takes into account temperature, humidity, and radiant thermal energy, is the preferred method for assessing weather conditions that precipitate heat-related illnesses. However, it may not be readily available. The heat index, which is shown in this slide, is the relationship between air temperature plus the relative humidity and how a person's body feels in that specific environment. A heat index chart may serve as a substitute in assessing the risk of heat-related illnesses on a given day. From this chart, we can see that there are different risks associated with exercise. The green is a caution area, so if the temperature or relative humidity puts us in a green area, there is a possibility of fatigue with prolonged exposure. The blue area is extreme caution, which means heat-related illnesses is possible with long exposure. As we get into the yellow area, that is a danger zone. Heat stroke is possible and heat-related illnesses are likely. The red zone indicates extreme danger. This is a high risk of heat stroke. We can see that we don't have to have a very high temperature to actually get into the red zone. We could have a temperature as low as 90 degrees to get us into the red zone. If we have a 95% or 100% relative humidity, we would actually be in the extreme danger red zone. If you have to practice when it is very hot outside or when the heat index indicates that there is a potential for heat-related illnesses, there are several steps that you can take. First, articulate your concerns to the coaches before the practice starts. Recommend a change in the practice schedule so that practices are occurring in cooler parts of the day. If practice time cannot be changed, then wearing less clothing or having more breaks may be helpful. All clothing worn should be breathable, for example, mesh over cotton. Once clothing is saturated or soaked, it should be removed and replaced so that evaporation can occur to help cool the body. When wet clothing is maintained, evaporation cannot happen at a very quick rate. Also, wearing light colors absorbs less of the sun's rays and can help keep people a little bit cooler. Our next section discusses heat-related illnesses. Heat-related illnesses are a set of preventable conditions ranging from mild forms, heat exhaustion and heat cramps, to potentially fatal heat stroke. Hot and humid conditions challenge cardiovascular compensatory mechanisms. Once the core temperature reaches 104 degrees Fahrenheit or 40 degrees Celsius, cellular damage occurs, initiating a cascade of events that may lead to organ failure and death. Early recognition of symptoms and accurate measurement of core temperature are crucial to the rapid diagnosis. Milder forms of heat-related illness are manifested by symptoms such as headache, weakness, dizziness, and an inability to continue activity. These are managed by supportive measurements, including hydration and moving the patient to a cooler place. Hypothermia and central nervous system symptoms should prompt an evaluation for heat stroke. Initial treatment should focus on lowering core temperature through cold water immersion. Applying ice packs to the head, neck, axilla, and groin area is an alternative. Additional measures should include transporting the patient to a cool environment, removing excess clothing, and intravenous hydration. Delayed access to cooling is the leading cause of morbidity and mortality in persons with heat stroke. Identification of at-risk groups can help physicians and community health agencies provide preventative measures. Heat illnesses are a very common problem in athletics. Some teams are restricted to the days and times that practice can occur, and this presents some unique issues. Heat-related illnesses represent a continuum of pathological states and affect a diverse population. Over a 23-year period, it accounted for nearly 5,000 deaths in the United States. When the heat index is greater than 95 degrees Fahrenheit, the mortality increases in relation to elevation of temperature and duration of the heat wave. In most cases, these fatalities were preventable. Populations at risk include older persons, children, and people who perform strenuous outdoor activities. People with heart and lung diseases, those with chronic mental disorders, and those taking medications that interfere with salt and water balance are also at increased risk. Early recognition of the symptoms and rapid cooling are crucial because heat stroke is a medical emergency. There is a lot of literature that is being published regarding heat illness and their treatment, so it's very important to keep up. In order from least to most severe heat illness include heat cramps, heat exhaustion, and heat stroke. Some of the most recent literature has suggested the following practices. Rectal temperature is the most reliable way to assess core temperature and differentiate between heat stroke and milder forms of heat-related illness. Cold water immersion is the preferred method for cooling an exertional heat stroke. Rapid access to cooling is the most effective method to prevent heat stroke fatalities. It is important to note that the level of evidence for all three of these practices is only a level C on the SORT scale, which means that this evidence is coming from a group consensus or an expert opinion rather than clinical trials. Heat cramps are the first level of heat illness and are extremely common. Heat cramps are caused by working hard in the heat, sweating heavily, and possibly inadequate fluid or salt intake. There have been some debate regarding pickle juice to treat muscle cramps. The same could be said for mustard. Science has suggested that the vinegar in the pickle juice and mustard may help prevent muscle cramps. Heat cramps, or exercise-associated muscle cramps, can occur in any setting, but are most common when exercising in hot and humid environments. Dehydration, depletion of electrolytes, and sodium losses from sweat all accelerate this type of environment, especially in those who sweat profusely. Treatment includes rest, prolonged stretching of affected muscle groups, and oral sodium ingestion. Intravenous normal saline may be used for more rapid relief, especially for severe, diffuse cramping or when oral repletion is not possible. Pickle juice is now being marketed in much the same way as Gatorade. You can even see some high-level athletes drinking pickle juice on the sidelines. The signs and symptoms of heat cramps include painful muscle spasms, particularly of the calf, thigh, and abdomen. They may be mild or severely painful. The patient is normally alert and oriented. The skin is wet and warm from excessive sweating, and the body temperature, pulse, and respirations are normal or slightly elevated, which is due to the exercise. To treat heat cramps, move the person to a cool area. Rest and replace fluids, preferably fluids with an electrolyte solution. IV fluid replacement may be necessary for people with multiple muscle cramps or cramps that return. Stretch the muscle, massage with ice if possible, or ice the cramp. It should be noted that this is the first stage of the heat illness progression. These patients should be closely monitored for future heat illnesses. Milder forms of heat-related illnesses are associated with a core temperature less than 104 degrees Fahrenheit and no central nervous system symptoms. Heat exhaustion is the inability to continue activity because of environmental conditions and is postulated to be caused by a central mechanism that protects the body in times of overexertion. Once a person has had heat cramps or heat exhaustion, they are more likely to get it again. Heat exhaustion is caused by prolonged sweating with inadequate fluid replacement. It may be associated with diarrhea or illness and is basically a state of dehydration. Common symptoms of heat exhaustion include headache, weakness, dizziness, goose flesh or goose pimples, nausea, vomiting, diarrhea, irritability, and loss of coordination. The skin may appear pale or ashen, with associated tachycardia, which is high heart rate, or hypotension, which is low blood pressure. Normal mental status is maintained. Patients with heat exhaustion should remove excess clothing and be moved to shaded, cool environments. They should be placed in a supine position, which means laying on their back, preferably with the legs elevated. Oral fluids are preferred over intravenous fluids for rehydration in those who are conscious, able to swallow, and not losing fluids secondary to vomiting or diarrhea. Vital signs should be monitored with transport to emergency facility if symptoms do not improve after 20 to 30 minutes. Heat exhaustion signs and symptoms include profuse sweating, cool clammy skin, pale or grayish skin, a weak rapid pulse. The body temperature is normal or slightly elevated around 102 degrees, extreme weakness or exhaustion, headache, extreme thirst or dry mouth in the feeling that they cannot get enough to drink, nausea and vomiting, disorientation or dizziness. The person may also have heat cramps. Sometimes the person slips into unconsciousness. To treat heat exhaustion, you should move the patient to a cool area with either shade or air conditioning. Remove extra clothing, ice or fan the body. Give them cool fluids as much as possible. They may need an IV for sufficient fluid intake. Rest and rehydrate for 2 to 3 days. Heat stroke is a true emergency that requires immediate recognition and treatment. This is defined as a pathological elevation of core temperature of 104 degrees Fahrenheit or greater and associated central nervous system disturbances. Classic heat stroke often develops slowly over days. It predominantly occurs in older people and those with chronic illness. Exertional heat stroke is a more rapid onset and is associated with higher core temperatures. It generally occurs in young, healthy people and is characterized by hot skin, with or without sweating, and central nervous system alterations. Early recognition of the differences between heat stroke and the milder forms of heat-related illness is crucial to avoid morbidity and mortality. Heat stroke is caused by thermoregulatory failure, the breakdown of sweating mechanisms due to loss of fluid without replenishment, and the body is basically cooking itself. The kidneys and the liver are the first to go. Signs and symptoms of heat stroke include no sweating or little sweating, hot and dry skin, red, flushed skin, a strong, rapid pulse. The body temperature is markedly increased, somewhere between 105 and 108 degrees Fahrenheit or higher. Disorientation and confusion is likely. Headaches, staggering, respiratory rates increase, blood pressure usually stays pretty level and seldom rises, and unconsciousness is extremely common. Physicians considering the diagnosis of heat stroke should obtain a rectal temperature as soon as possible. This is also the gold standard of practice for athletic trainers. Heat stroke is a life-threatening emergency. The treatment begins with stabilizing the patient's airway, breathing, and circulation, calling EMS but cooling the body before transport, moving the person to a shaded area, and removing clothing. Cool the body with water, ice, a fan, and any other means possible. Give fluids, but only if they are conscious, and act quickly. Morbidity is greatly reduced with rapid cooling. If there are no other life-threatening complications, on-site cooling before transport to the emergency department is preferred. Cool water immersions is the treatment of choice when available. It is associated with the lowest morbidity and mortality rates, and patients with exertional heat stroke treated with cold water immersion have a survival rate of almost 100%. Large cooling tanks are often used in outdoor activities such as football practices or mass participation events such as a marathon. Although the cooling rates for cool water immersion have been shown to be superior, applying ice packs or cold wet towels to the head, neck, axilla, and groin is an alternative option. Rapid air movement with a fan in combination with spraying a moderate temperature mist of water encourages evaporative and convective cooling and is also effective. Intravenous hydration should be initiated as soon as possible to protect renal blood flow and avoid complications such as rhabdomyolysis. As a summary of the determination of medical referral for heat illness, heat stroke is the extreme emergency. Athletes must be cooled as quickly as possible, then transported to the nearest medical facility. Heat exhaustion, the athlete should be removed from activity and should have medical attention if hydration and other means do not eliminate symptoms. Heat cramps, the person may return to activity once they are cooled, rehydrated, and free of cramping, but this person needs to be watched closely for reoccurrence. We have discussed heat illness. At the other end of the spectrum is cold illness. Luckily for those of us living in South Texas, having to deal with cold illnesses is not something that happens very often, but in other parts of the country and world, this is a hard issue to deal with. The two most common cold illnesses are hypothermia and frostbite. Hypothermia is a decreased body temperature occurring when the body is unable to maintain a constant core. Hypothermia occurs when your body loses heat faster than it produces it. The most common cause of hypothermia are exposure to cold weather conditions or cold water, but prolonged exposure to environments colder than your body can lead to hypothermia if you aren't dressed appropriately or you can't control the conditions. Specific conditions leading to hypothermia include wearing clothing that is not warm enough for weather conditions, staying out in the cold too long, inability to get out of wet clothes or move to a warm, dry location, accidental falls in water, as in boating accidents, inadequate heating in the home, especially for older people and infants, and air conditioning that is too cold, especially for older people and infants. Normal body temperature is around 98.6 degrees Fahrenheit or 37 degrees Celsius. Hypothermia occurs as your body temperature passes below 95 degrees Fahrenheit, so this doesn't take a very large drop in body temperature to be significant. When your body temperature drops, your heart, nervous system, and other organs can't work normally. Left untreated, hypothermia can eventually lead to complete failure of your heart and respiratory system, which then leads to death. Hypothermia is most often caused by exposure to cold weather and immersion in a cold body of water. Primary treatments for hypothermia are methods to warm the body back to a normal temperature. With cold weather or exposure to the cold, there is a vasoconstriction of the fibers in the surface of the blood cells, which prevents the blood from going to the skin and attempts to maintain this core body temperature. This shunting of blood from the shell to the core to maintain vascular volume is known as cold diuresis. Cold weather also stimulates the release of chemicals that increase metabolic activity and heat production. If vasoconstriction and increasing metabolic activity do not work, shivering begins to produce heat through involuntary muscle contractions. When the core temperature falls below 94 degrees Fahrenheit, essential biochemical processes begin to slow. The heart and respiration slow, cardiac output and blood pressure fall. As the skin and muscles cool, the shivering increases. If the temperature continues to drop below 90 degrees Fahrenheit, shivering will cease and muscles will become stiff and cold. Shivering is likely the first thing you'll notice as the temperature starts to drop because it is your body's automatic defense against cold temperature. It's an attempt to warm itself. For mild hypothermia, signs and symptoms include shivering, dizziness, hunger, nausea, faster breathing, trouble speaking, slight confusion, a lack of coordination, fatigue, and increased heart rate. For moderate to severe hypothermia, as your body temperature drops, signs and symptoms include shivering, although hypothermia worsens and shivering stops, clumsiness or a lack of coordination, slurred speech or mumbling, confusion or poor decision-making such as trying to remove warm clothing, drowsiness or very low energy, lack of concern about one's condition, progressive loss of consciousness, weak pulse, and slow, shallow breathing. Someone with hypothermia usually isn't aware of his or her condition because the symptoms often begin gradually. Also, the confused thinking associated with hypothermia prevents self-awareness. The confused thinking can also lead to risk-taking behaviors. In hypothermia in infants, the typical signs include bright red or cold skin, very low energy, and a weak cry. Hypothermia is not necessarily related to the outdoors. Hypothermia isn't always the result of exposure to extremely cold outdoor temperatures. An older person may develop mild hypothermia after prolonged exposure to indoor temperatures that would be generally fine for younger or healthier adults. This can occur in a poorly heated home or in an air-conditioned home. Signs and symptoms of this type of hypothermia may not be as obvious. Treatment for hypothermia should include maintaining basic life support, activation of emergency medical services, moving the victim to a warmer area, remove wet clothing and replace with dry clothing, and if the victim is conscious, providing warm fluids. Frostbite is caused by the freezing of soft tissues. Within the cells, there is fluid. As frostbite continues to progress, this fluid turns to ice crystals in much the same way as water turns to ice in an ice tray within the freezer. There are three main types: chilblains, superficial frostbite, and deep frostbite. The severity and damage depends on the depth and penetration of the cold resulting from duration, temperature, and wind velocity. Areas commonly affected are the fingertips, toes, earlobes, and the tip of the nose. The skin usually appears red and swollen. The individual may complain of an itchy sensation followed by numbness. Please do not let them itch as it can cause more skin damage. The area will then turn white with a yellow or blue tint that looks waxy. Deep frostbite is completely numb to the person and they may not feel anything at all. Chilblains are the result from prolonged and consistent exposure to cold for many hours. This can also indicate a problem in peripheral circulation. The signs and symptoms of chilblains include redness that may turn white, tingling, and pain in the fingers and toes. The treatment is simple. We just try to prevent further cold exposure. Here's an example of chilblains. Superficial frostbite involves the skin and underlying tissues. For the signs and symptoms, the area will feel firm to the touch, but the tissue beneath is soft. This firm feeling is actually ice crystals within the cells. The treatment is to take the person indoors and to protect them from further refreezing. Remove any clothing, jewelry, or rings and immerse the area in heated water. Please remove any jewelry or rings prior to heat immersion. When heat immersion begins, blisters may form, and getting rings or jewelry off may be very difficult. If jewelry or rings are too difficult to remove, you may have to cut them off the person. To rewarm the tissue, immerse the area in heated water, 104 to 108 degrees Fahrenheit for 30 to 35 minutes. Avoid hot water. This may burn the person and cause further tissue damage. For deep frostbite, this involves tissues deep to the skin and subcutaneous layer. This may result in destruction of the injured tissue. The signs and symptoms include the skin feeling hard because it's actually frozen tissue. As the area thaws, it will feel numb and appear blue or purple. Capillary damage may leak into surrounding tissue and cause swelling. Treatment for frostbite includes first aid care and medical treatment. Depending on the severity of the frostbite, you can treat very mild frostbite or frostnip or chilblains with first aid measures. All other frostbite requires medical attention. Do not rewarm frostbitten skin with direct heat, such as a stove, heat lamp, fireplace, or heating pad, as these can actually cause burns. If there is any chance the affected area will freeze again, do not thaw them. If they are already thawed, wrap them so that they do not refreeze. Take pain medication. If you are in pain, take over-the-counter ibuprofen, which will reduce pain and inflammation. Do not walk on frostbitten feet or toes if possible. This further damages the tissue. When the part is rewarmed, dry the area and apply a sterile dressing. Cover the entire area with towels or blankets and transport. Transport with the limbs slightly elevated. Be aware that blisters may develop beneath the outer layers of the skin and gangrene may develop within 2 to 3 weeks. Throbbing, aching, and burning sensations may last for weeks. The damaged skin may remain permanently red, tender, and sensitive to the cold. Frostbite can be prevented. Here are some tips to help you stay warm and safe. Limit the time you're outdoors in cold, wet, and windy weather. Pay attention to the weather forecasts and wind chill readings. In very cold, windy weather, exposed skin can develop frostbite in a matter of minutes. Dress in several layers of loose, warm clothing. Air trapped between the layers of clothing acts as insulation against the cold. Wear windproof and waterproof outer garments to protect against wind, snow, and rain. Choose undergarments that wick moisture away from your skin. Change out of wet clothing, particularly gloves, hats, and socks as soon as possible. Wear a hat or headband that fully covers your ears. Heavy woolen or windproof materials make the best headwear for cold protection. Wear mittens rather than gloves. Mittens provide better protection. Or try a thin pair of glove liners made of wicking material under a pair of heavier gloves or mittens. Wear socks and sock liners that fit well, wick moisture, and provide insulation. You might also try hand and foot warmers. Be sure that the foot warmers do not make your boots too tight, restricting blood flow. Watch for signs of frostbite. Early signs of frostbite include red or pale skin, prickling, and numbness. Plan to protect yourself. When traveling in cold weather, carry emergency supplies and warm clothing in case you become stranded. If you will be in a remote territory, tell others your route and expected return date. Do not drink alcohol if you plan to be outdoors in cold weather. Alcoholic beverages cause your body to lose heat faster. Eat well-balanced meals and stay hydrated. Do this even before you go out in the cold, and it will help you stay warm. If you do become cold, drink warm, sweet beverages such as hot chocolate to help warm you up. Keep moving. Exercise can get the blood flowing and help you stay warm, but don't do it to the point of exhaustion.